Specifically or specially, it affects the age group between 15 to 45 years of age. Now, the causative organism that is responsible for causing this disease, Microbacterium tuberculosis. So, this is a bacteria. Okay, so these are also microorganisms, but when we talk about COVID-19, so this is infected by virus, caused by virus, but tuberculosis is caused by bacteria. Next, the signs and symptoms of tuberculosis. So these are fever, having chest pain, feeling chills, long-term cough, fatigueness, night sweats, and weight loss. But that does not mean that anyone having most of these symptoms may be infected by tuberculosis. I am also having a cough, and few days back I was having fever. But that does not mean that I am suffering from tuberculosis. Okay, so for this, to get the confirmation, it is very necessary that we should consult a expert person, that is our doctor, who are always ready to take care of us. So if ever we have these symptoms, we must go and consult a doctor. This is very necessary. Next, how transmission occurs. So from the picture here, we can observe that if a person infected, here this is the figure, if a person infected with the tuberculosis bacteria comes in contact with a healthy person, then it may be that it is for sure that the bacillus will be get transmitted to the healthy person. So it is very necessary that if we have developed such symptoms, we should consult a doctor, because from one it will get transmitted to the second person and a chain will then form. So we have to stop the chain, right? So it has been reported that if one TB case remains untreated, then it results in 10 to 12 cases of TB per year. So this is a matter of global concern for this reason. Next, about the history of tuberculosis. So during 1800, lots of people died due to tuberculosis in United States and Europe. And in the year 1882, Dr. Robert Koch, a German physicist and a microbiologist, he then discovered this bacteria, that is the causative organism of this disease. He discovered this and announced the discovery on 24th March. And this is why every year on 24th March, it is designated and observed as World TB Day. The motive behind is that to aware the common people about the impact of this disease around the world. So, although this bacteria was discovered in 1882, but it existed since 3 million years ago. Now, global impact of tuberculosis. So, what is the global impact? Why we observe and why there is requirement to aware the people? Tuberculosis is the leading infectious disease killer in the world and one of the top 10 causes of death worldwide. According to the report of World Health Organization, in 2015, there were around 10.4 million cases of TB. And India alone is responsible for about 1/4 of all the TB cases around the world. In the year 2018, World Health Organization estimated that around 10 million cases of TB are there in the world and 1.3 million deaths are due to this TB. So this indicates the global importance of awareing mass people about the impact of this disease. So now, what is the status of our country? India ranks second indeed worldwide, as far as TB related mortality, that means death due to TB in the world. So India ranks second. And this is a very recent report. Next, the diagnostic approach of tuberculosis. Sputum smear microscopy. So this is the very principal mode of detection. It is also known as acid first bacillus stain or a TB smear. So for this, the blood is collected from the suspected patient, and if in the sample equal to or more than 5000 bacilli per ml is detected, then it may be said the patient is contaminated with this bacteria. Next is radiography. So it is well known to us, that is the chest X-ray. So if X-ray report shows cavitation in the lungs, that means the suspected person is infected by the tuberculosis. Next, the molecular level of diagnosis. So genotypic and phenotypic method. The phenotypic method involves first plaque method, while the genotypic method involves PCR and the NAT technique. The serological test, so it involves the interferon gamma release assay, which helps in the detection of the TB antigen, if any, in the body of the suspect. Next is the quantiferon gold test assay. It is an immunochromatographic test. So this test, however, as per my knowledge, it is unavailable in India. Last but not least is the Mantox test. It is also known as the skin test. So in this, a chemical is been injected in the forearm of the suspected patient, and it develops a bump on the skin. It is given only in the skin. So depending upon the size of the bump, that means if the bump মানে কি এটা একটু যদি গোটা হয়ে যায় না, ফোড়া হয়ে যায়, তো ইনজেকশন দিয়ে একটা ছোট্ট ফোড়া করা হয়, ঠিক আছে, স্কিনের মধ্যে 24 থেকে 72 ঘন্টা পরে এটাকে আবার দেখা হয়, এটার মাপ নেওয়া হয় যে যদি 15 mm হয়ে যায় বা তার থেকে যদি বড় থাকে ওই গোটাটার সাইজ, তাহলে ওই পেশেন্টের মধ্যে ইনফেকশন আছে টিউবারকুলোসিসের, এটা কনফার্মড, ঠিক আছে। So next is the treatment of tuberculosis. So there is a list of drugs. For example, isoniazid, rifampicin, pyrazinamide, ethambutol, many more. But that doesn't mean that, say for example, if I have got infected with this bacteria, that means I have tuberculosis, okay, then I have the list of this. Should I go to the chemist and buy the drugs and take all the medicines by myself? No, a big no, okay, because see, there are many cases of treatment resistant. Say for example, I am the new person who has got this disease, so for me the treatment will be different, okay. Say for example, another person who have few years back already have this disease, and again some symptoms have developed and he got confirmed that he is a tuberculosis patient, then for him the treatment regimen will be different. So although I have given this list, but that doesn't mean that we will take medicines of our own, okay. Next, the vaccination process. So this BCG, we all know BCG at least, Bacil Camelty-Guerin vaccine. This is given to the newborn by the government of India, okay. This is for the prevention of this tuberculosis. Next, there are modern approaches like immunotherapies. They are depending upon the immunological status of individuals. Immunotherapies are provided to the patients. So what we have to learn, or what we have to remember, that these things, diagnosis, treatment, these things are not to remember by ourselves, okay. This will be done by our doctors. What we have to do, first যদি আমাদের কারোর কাশি সর্দি যেগুলো সিমটম বলেছি যদি কারোর থাকে আমরা সবের প্রথম গিয়ে ডক্টরকে দেখাবো, এইটা আমাদের করতে হবে, ঠিক আছে? 2 নম্বর হলো কি, যা ট্রিটমেন্ট দিবেন সব আমাদের মেনে ওরকমভাবে মেডিসিন নিতে হবে। অনেক সময় হয় কি, এটা টিউবারকুলোসিসের ধরো 2 মান্থস বা 3 মান্থসের কোর্স থাকে, অনেক সময় হয় বা সাধারণ কোনো অ্যান্টিবায়োটিক নিলে একটা ডোজ থাকে, ঠিক আছে, যেমন 1 মান্থ ওরকম। তো অনেক সময় হয় আমরা 4-5টা মেডিসিন খাওয়ার আরে ঠিক হয়ে গেছি আর নিব না, বাস হয়ে গেছে। বাট দিস উইল নট কিওর ইয়োর টিউবারকুলোসিস। তো যতটুকু পরিমাণে ডোজ ডক্টর আমাদেরকে প্রেসক্রাইব করবেন, যত দিনের জন্য করবেন, আমরা সম্পূর্ণ সেই ডোজটা কমপ্লিট করব। কথা বোঝা গেছে? Next, we know the proverb that prevention is better than cure. So, what can we do to prevent ourselves from developing such sort of diseases? So, first is the vaccination. We should take our vaccination at times. So, if I talk about this COVID period, vaccinations have been provided by the government of India at free of cost, right? But many people were seen that no, we will not take. My God, kita na kita dilaise, kita hoy jaibo, right? So that should not be. Vaccine are being produced by series of experiments were carried out. Okay, so whenever vaccines are available and they are given, we should take our vaccine. Next, be healthy. So how we will remain healthy? কি করে হবো? Junk food খাবো? No. We will have fruits, green vegetables and do lots of exercises, right? Next is to stop smoking. So we have to stop the smoking. Next is we will maintain a good hygiene. And last but not the least, we will try to avoid prolonged contact with someone. So these are the papers actually I have followed and tried to gather knowledge from there, because I am not an expert in this field. Experts, resource persons are there among us and they will be discussing in details about the diagnosis or treatments. They know more than me. Okay, I just try to gather knowledge and try to present before you all. So thank you so much for your kind patience, and I would like to thank our principal sir, our HOD sir, Department of Zoology, and the dignitaries for giving me an opportunity to deliver this talk. And I apologize to Pradeep De sir. I have made many mistakes or I have not incorporated many things, I know, because this is not my field of expertise. So I apologize for that. Thank you so much everyone. Thank you.